Hi, my name's Patricia Warby of Alchemy Therapies, and I want to talk tonight about something that perhaps you don't think about very often, which is the nature of shame and trauma, which are very linked because one tends to engender the other. And I'm not going to sort of talk about how that might come about because that's the subject of a different video. I've covered it before in a lot of different ways on various webinars that I've done, but I want to talk about the therapy options for dealing with it because people often show trauma in many ways. They may have what's called medically unexplained symptoms, things like chronic pain, lack of energy and fatigue, brain fog, because basically trauma is something that affects the body and it gets very embedded into the neurological system as what we call the freeze response, and people become sort of optimal. They don't function properly, and it tends to get worse with time as well. Now, you'll find a lot of people with chronic fatigue or fibromyalgia or some autoimmune conditions, and also anxiety. I think anxiety is one of the commonest symptoms that I see, particularly social anxiety. We tend to think it's something that has happened to us that we should remember, but it's not always the case. It can be something that happened pre-birth or at birth or in the first few years of life. For instance, if you were separated from your mother for whatever reason, perhaps your birth was difficult, and you were premature or something like that, or you had some sort of condition that meant you were in and out of hospital. It can be just that your mother wasn't able to care for you in the way that you needed, or maybe there was a life threat where your heart stopped beating at some point, and although you survived, your body remembers those events as a deep sense of shock and a sense of ever-present threat. Now, I don't want to go into the deep sort of neurochemistry of that because, as I say, I've covered that elsewhere. What I want to talk about today is actually how we deal with that in therapy. So when people come to me, they often ask me, the first question they ask me is how do you work? What do you do? And I always find that question really hard to answer because I have a set of tools that I use. But if I focus on one of the tools, I very often ignore that therapy is relational, and actually the tool itself is not as important as the feeling you get when you're with the therapist. Do they make you feel safe? Do they make you feel that you can open up and relax your guard a little so that you can start to feel what you need to feel in your body? Because one of the effects of trauma is that it disconnects us from ourselves, and instead of inhabiting our bodies, we often become highly dissociative of our bodies. And, if you have a phobia of touch, which is very common, or as I say, a social anxiety where you feel inherently unsafe in the company of others, this is a body memory of a time when you weren't safe, when your body fell under deep threat. But it plays itself out unconsciously, so in order to counter it, we have to provide the opposite to threat, which is safety. And safety, and by that I mean bodily safety. I don't mean safe in the outside world necessarily. I mean that when you come and sit with me, whether you do it in person or over Skype or online, you have to feel that I am holding the space for you. I'm holding you in a virtual environment where you are safe to explore some of those emotions that you have disconnected from, that have felt so frightening and frankly anxiety producing. Sometimes the anxieties come because the emotional memory wants to come up and we repress it because we're afraid of it. We don't understand, we don't know what it is, and we fear that we will be overwhelmed if we do remember. So the tools are less important than putting it all together in this framework of absolute trust in yourself and your own body to help release you. And the way I do that a lot with grounding. I use grounding techniques. I'm very fond of something called havening, I've described that in a separate video, but it's basically it's a technique where you actually simulate stroking. You do it for yourself, and it actually has a remarkable ability to calm the neurological systems, the autonomic nervous system particularly, in the here and now. So you actually come back to being in the room, in your body, and in this space and time, which for many trauma survivors is something they rarely do. They're always busy, distracted, focusing on anything other than their own internal feelings. So getting you connected and grounded is absolutely key to then the deeper work, which is where we may look at specific memories, if you've got some that you do remember, or body sensations even, because as I say, that's another form of memory too. Connecting with those, maybe using some of the tools like tapping, EFT, or eye movement desensitization and reprocessing, which is using the movements of fingers, or sometimes you can do it with tapping on each knee, and sometimes you can do it through the ears as well. And some therapists use an auditory signal that goes from one ear to the other. That's another variant of EMDR. But overall, what it's about is honestly connecting to the body and doing it in a way that feels comfortable. Even, dare I say, an adventure rather than something terrifying. I have to get you to feel curious about yourself again, to understand that some of the symptoms you're having are not so frightening. They're actually the way that your body is trying to dialogue with you. You've lost the ability to interpret and to understand what it's trying to tell you. And in crushing that sense and not paying attention, that's when symptoms are driven deeper into the body. So, and this isn't just my understanding, this is, a very widely understood view now by a lot of the theorists and practitioners in the field of trauma recovery. So actually the voice is really important as well. So keeping my voice steady and even, but having a lot of prosody. In other words, it rises and it lowers, and there's a lot of emotion in my voice. So I'm not monotonal and rather harsh, because that would be very annoying for people who are traumatized. So they like to hear voices that modulate well, and faces that move, okay? Because often people who've had trauma find it difficult to trust others as well as themselves. And what they're looking for is a sign of the other person being empathetic with them. Now, some people have gone so far outside their bodies that they actually struggle with eye gaze, and so they'll be looking all over the room but at me. And so my job is to just bring them back, and gradually through havening, through maybe tapping, any other methods, allowing them to reconnect with me initially as a cipher. I'm a cipher for a safe place, and then gradually with their own body experience. So that's kind of in a nutshell what I do. I use humour as well. I use authentic words to describe your experience. So I don't try and put words into your mouth. Neither do I ask you to tell me all about your trauma, because that's a problem. If you are very highly sensitized, just describing what happened to you can trigger the feelings, and they become overwhelming again. So we don't do a lot of talking. We do work with, as I say, sensation, body posture. I'll notice what's happening in your face, because your face can't lie. If something's unacceptable to you, it will be obvious to me. So something that I say or something that you've tried to persuade yourself isn't acceptable, the face will show that. It'll either register a shock or it'll go very dead. So I work with what your body tells me as well. So, people who are angry or defensive will often stick their necks forward. People who are collapsed and defenseless often are very, very collapsed inwardly. as I say, people who are looking all over the place but at me, I know are very phobic of their own internal experience. And so as a therapist, you really have to learn these techniques of tuning in to the person you're working with really, really instinctively. I can't say that I sit down and I make a list of all the things I need to notice, because it's become now something I do without thinking. I notice stuff. And when I call attention to it and I say, have you noticed that your eyes are going wide when you're talking about that? Or there's a jaw muscle twitching. Or someone today was rubbing their neck and I said, what's going on with your neck right now? And she said, oh, it's gone into spasm. That is your body communicating with you and telling you something that it needs to tell you. It's a memory of a time when you were under threat. And just by calling attention to it in this present moment in a safe space brings your thinking brain, your cortex back online in order to provide much needed context that says, that's happening, it's a memory, it's over, I'm safe, I'm not there anymore, it's okay. And the relief for most people when they truly feel that in their bodies, that they're not back there where they were, because the body memory, unfortunately, has ever present now. It doesn't understand past, present and future. It's all in the now. The cortex, however, has an awareness of time. And so bringing the cortex, the thinking brain, back online is so key. And noticing and being curious about what happens in your body when you describe certain things, or when I say certain things, or you do, means you take a lot of the fear away of actually experiencing those things, because fear closes us down. Okay, so basically that's what I do, and it's hard to describe. You have to kind of be there to appreciate it. But I hope it's given you an idea that you might want to, if anything seems to be troubling you with anxiety or unexplained symptoms that I've just described. So, all right, I'll leave it there for you to ponder. Body safety, it's really key. Bye for now.